I've not been consistent with videos lately because I've been working on contract and making sure I get my I's dotted and T's crossed. Mistakes most new attending physicians make is the haste in signing contracts without thoroughly reading through it and getting an expert, like a lawyer, to review the document. Our residency salary is not enough, as most of you may know, to even pay a lawyer to review that document, considering most of us living from paycheck to paycheck. During the process, I've been told several times to watch whom I sign a contract with and being mindful that I'm not overworked to prevent becoming burnout, as this has been a prevalent issue in the field of medicine for many years. I may have a plan and a strategy to maximizing my income as an attending physician in a few months, but sometimes this comes at a cost of losing it all with just one lawsuit. This, my friends, is one of the major reasons many people in the healthcare field quit. You do all you can to improve a patient's health and disease process, and just one hiccup, just one mistake raises your hard work, leading to an increase in your malpractice insurance premium. Not forgetting the student loans you are yet to put a dent into. Scanning through medical content creators on YouTube, I've listened to reasons made by most of them, and I don't blame them for their decisions. But is it worth quitting medicine? Hi, and welcome to my channel. My name is Resident Dr. Frederick Acquah. To the pre-med student, to the medical student, to the medical or surgical resident, to the fellow, attending physician, the nurse, the PA, NP, and others watching me today, this is why you should not quit the field of medicine. Let's go. Welcome back. I read an article discussing a survey done by JAMA showing about 50% of more than 9,000 US physicians across medical specialties surveyed in 2020 are burnout and may potentially lead to medical doctors leaving or planning to leave this field. Now, if you look at a timeline of when this was done, you will agree with me that the COVID pandemic played a major role. Depending on what specialty, you had more or little work during the pandemic. Hospitalists and critical care physicians had more work on their plate compared to the surgeons, based on what I observed personally. Primary care offices were also flooded with patients wanting to get tested. CMAs and nurses getting sick prohibited them from coming to work, and their importance were felt strongly, making you understand that everyone, no matter what role you play in medicine, is vital to the strength and efficiency of the practice. For fear of contracting COVID-19 infection led to senior doctors retiring early. I came across another article while preparing for this video, and I found it not to be too far from the truth. People are leaving due to burnout, which I already discussed. Another reason why people are leaving the field of medicine is due to increased verbal abuse and bullying by patients. Believe me, this is happening and it's sad. My place of training has this sign on entering the hospital that we do not allow this kind of behavior, and security will walk you out in case you display that. Again, we point to the pandemic and several misinformation staggering on the internet these days. A family member comes to the hospital and make demands on studies they found on the internet and demand that a drug used in the study be used for their family member. Sadly, nurses at bedside experience this more often, and it's disturbing. Another reason why people are leaving the field of medicine is due to insufficient income. Compared to the work we do and what it takes to become a doctor, I agree that the compensation doesn't match. The interesting thing to hear is when we pick up more shift or sign another contract, we risk of becoming burnout, as 28% had stated in Medscape survey in 2022. Due to long hours and lack of family time, people are quitting medicine. For me, I say that there isn't a lack of family time, it's just inadequate, especially if you are in a committed relationship and or you have kids, you feel this much. People are also leaving because of lack of independence. According to Physicians Advocacy Institute, as of 2022 in January, over 70% of doctors were employed by hospitals or corporate entities. Due to this, Doctors have to meet certain benchmarks and complete required caseload at a certain time. It's not our fault that we don't get to spend a lot of time with you when you come to visit us for your appointments. We have to hurry and see the next patient so we can meet our quota for the day. Wonder why I mentioned physician shortage in the coming years? Well, these are just a few reasons. Nevertheless, if we can have transparency from the corporate office, if we can shorten the duration of medical training and hone in on solidifying the foundations of medicine, if we can make physician shadowing and mentorship a requirement to aspiring doctors who can at least see firsthand of what they aspire to be, we can increase residency spots across the country, and the many other reasons discussed by experts, we may be able to slash the statistic and revive this field. My love for medicine started when I was a little boy. Science and medical things made sense to me, and as I got older, my options in medicine also grew to include teaching and leadership, aside from patient care. To make me well-rounded and competitive, I earned an MBA in healthcare management. In my opinion, medicine is a calling. It's not meant for everyone. If you come in for the money, you will regret it. It may be more beneficial for you to get an IT or finance training since that's where the money is. To the young mind thinking of medicine, ask yourself this question every single day. What is my why? Why do you want this career path? And are you willing to forgo everything for it? In other words, how bad do you want it? Stakes are high, and the imposter syndrome stares at you in the face almost every time. Did I already mention that it takes a lot to become a doctor? So to my future self, don't quit. To the young black man hoping to rewrite the generational story of your family, never give up. Everyone should revisit their why, despite the circumstance they face in this field day in, day out. If your current workplace environment makes you fall into one of the categories discussed above, then I encourage you to change your place of work. If you have to travel out of state or work in a different country, just do it. If you plant a seed in the soil and you do not water it or give it the necessary nutrients to grow, it will surely die. Don't let your place of work kill your dreams and vision. Someone is waiting on you to fix their spinal issues, another to help relieve their pain, yet another to help maintain their diabetes under control. You are needed. We need you in this field, so do not quit. The one who always endures to the end is the one who deserves the crown. I'll see you in my next video. Shalom.